As you get older, it's harder to make vitamin D. Once you start dropping below 50, you start to see an increase of SARS-CoV-2 virus. I need to take about 4 to 5,000 units daily.
Dr. Roger Seheult is a quadruple board-certified physician who has helped millions of people fight viruses and fix inflammation.
He will teach you new research about vitamin D and how much you need for optimal health.
That I was just like any other physician until the pandemic hit. People started coming into the hospital sick, and we had nothing really for them in terms of treatments. I started to look for things that might boost the immune system, things that might enhance it. Many of the patients that were coming in and doing well because they had high vitamin D levels, it might not have been just the vitamin D that was doing the heavy lifting. If you're going to supplement with doses more than 1,000 to 2,000 international units, you really need to get your level checked. Anything north of Tennessee or that latitude, you're not going to get enough vitamin D.
So sunscreen, does that affect the absorption or the amount of vitamin D that we can get?
Yes, it will prevent us from making vitamin D in our skin.
I wanted to ask about the vaccine associated with the virus a few years ago. If people had enough vitamin D, do you think the level of hospitalization would have been less?
People's systems would have been much more healthy, and therefore the effect of the virus on a population as a whole would have been much less. There's plenty of patients in my clinic that I did not recommend them getting the vaccine.
You mentioned a next pandemic is coming.
I don't know when it's going to happen, but I can tell you I want to be prepared for that. Let me tell you what I have seen in terms of the data. So first of all,
this episode features Dr. Roger Seheult, and we're talking about a very common deficiency that 70% of us have, but don't really know. That is vitamin D deficiency. Now, if you haven't had your vitamin D checked, by the end of the episode, you'll understand why you need to do so. And all the resources for this episode can be found at the Primal Labs, which is at the top of this episode and also in the description. Now, if you're learning from and enjoying these free episodes, please hit the subscribe button because we know that food is medicine. And by the simple act of subscribing, you can help share the message to millions more people that need to hear the truth. And now for the episode with Dr. Roger Seheult. Dr. Seheult, welcome.
Thank you so much for having me on.
Now, vitamin D is something that not many people talk about, but it's so important for our overall health. It helps with our immune system and fights viruses. It can even help with autoimmune conditions and cancer. But most people are deficient in vitamin D and they don't even know. And the recommended dose of vitamin D is simply not enough to protect us. So today, Dr. Seheult is going to share his decades of research and experience. We're going to talk about how much vitamin D you actually need, and it's 10 times higher than you think. We're going to talk about vitamin D toxicity and how high doses of vitamin D actually could help you with the virus that happened a few years ago. So Dr. Seheult, my first question. You are a quadruple board certified doctor, so you see a lot of sick patients. How many of those patients are deficient in vitamin D?
Well, they don't all come with vitamin D levels. I wish they did. Honestly, where I work in Southern California, you have to show evidence that you need a vitamin D level. And unfortunately, most insurance companies are still sort of stuck on the old research, and they believe that the only reason why you would need a vitamin D level is if somebody has osteoporosis or some bone indication for that. So I know what your question is, and it's basically how common is vitamin D deficiency in the population? And it's actually a lot more common than you would think, especially in my practice in Southern California. We do see it quite a bit. And you'll see this recurring theme over and over again. We know that we can make our own vitamin D in our skin from being exposed to sunlight. The problem is that we're indoors much of the time, and the ultraviolet radiation from the sun that's responsible for making vitamin D in our skin can't get into our homes. And so it's important to get outside. So to your point, there are quite a number of people that I see that have low vitamin D levels.
Okay, so if someone is just watching this and they're thinking, do I have low vitamin D? How likely is it? So is there a number, a percentage that you could give so that people can understand that so many people are low in vitamin D?
Yeah, I mean, it depends on what level you're looking at. A lot of the lab values will say that you should be at about 30 nanograms per milliliter, for instance. That's a very low bar, in my opinion. I think probably closer to 50 is probably a bare minimum. It's what I try to aim for. If you're looking at 30, there's still probably 20-30% of the population, depending on how you measure and where you measure, that may be below that level and at risk for having vitamin D level vitamin D levels that are so low. If you're looking for a more optimal, and this has to do with how much vitamin D do you need for bone health, and how much vitamin D optimally do you need for your immune system to be working. Those are different levels. The vitamin D levels for bone don't require that much, probably 20 to 30 in terms of that threshold. But in terms of optimal health, we can see even from the SARS-CoV-2 data that we've looked at on our MedCram channel, that once you start dropping below 50 nanograms per milliliter, you start to see an increase in the incidence of SARS-CoV-2 virus.
So that was quite interesting. And I want to talk more about the virus, which happened a few years ago, and the role of vitamin D to actually help people with the virus, because many people suffered during that pandemic. And it's quite interesting that if they had sufficient vitamin D, more than sufficient vitamin D, that would have actually helped them, and that possibly there could be far less deaths. But I want to talk about the role, firstly, of vitamin D for the overall body, because you mentioned it's needed for calcium and the bones, but that's just one part. There are so many other aspects of vitamin D that people just don't think about. Can you elaborate more about that?
Yeah, we know, for instance, that there are vitamin D receptors in our immune cells. First of all, let's step back and look at the vitamin D molecule. It's actually made from cholesterol or cholesterol derivative. And as a result of that, it's what we call a steroid hormone. Incidentally, I when I was in college, I was a chemistry major, and I used to help out in the graduate students' laboratory making vitamin D analogs, coincidentally. And it was an organic chemistry laboratory. So we would be using all sorts of chemicals to make vitamin D analogs that we would send over across the campus to the biochemists, and they would test these vitamin D analogs on various different proteins. So in the body, steroid hormones have a very important role. Many hormones in the body, like, for instance, insulin, glucagon, TSH, thyroid stimulating hormone, many of these hormones simply go throughout the blood, and then they are attached to a receptor on the outside of the cell that causes the cell to have some effect. Steroid hormones are different. Steroid hormones actually go through the membrane of the cell, go right into the nucleus of the cell, and aid the cell in either upregulating transcription of DNA products or downregulating or upregulating. So steroid hormones have a very interesting role to play. There's a number of steroid hormones: testosterone, estrogen, progesterone, aldosterone. These are all steroid hormones. And vitamin D, if you were to look at these structures, fits right into that family. And so it shouldn't be surprising that there are many receptors all throughout your body that have receptors for vitamin D.
So vitamin D, it's not just a vitamin. If we think about vitamin C, vitamin E, vitamin A, I mean, vitamin D is so important for overall health. I want to focus on different things where vitamin D plays a crucial role. Let's first talk about autoimmune conditions. How does vitamin D help with that?
Well, we're starting to work that out. It obviously is an immune modulator. So an autoimmune condition is where your immune system starts to attack itself. And there are certain cells that are required to ramp down hyperimmune responses. And vitamin D may be one of those modulators. So it's not surprising that we find many vitamin D receptors throughout the immune system, T cells, et cetera. So we believe that vitamin D may be actually helping attenuate or modulate the immune system. We actually did a video on our MedCram channel probably a year or two ago that showed a study that had come out where they looked at vitamin D levels in a prospective interventional trial where they actually gave vitamin D prospectively and then watched and measured, and they found that autoimmune conditions were lower in the vitamin D group.
So it's important to have enough vitamin D. I'm guessing that the 30 that you mentioned earlier, even the 50 that you mentioned earlier, is not enough.
Well, it's certainly 50 was probably good enough. You could probably get as high as even 70. I check my levels, and I do take a vitamin D supplement because, as of my practice, I'm usually indoors a lot as opposed to maybe other people who are outdoors. And so it really depends on your skin type, where you are, in the world, how long you're spending outside. All of these are factors. How old you are. As you get older, it's harder to make vitamin D. It's more difficult for your body to produce vitamin D in your skin. And so we tend to try to, at least I do in my patients, try to aim for a 50 at least.
Okay. What about cancer? Because there's so many different ways that people think that they can prevent or treat cancer, but vitamin D plays a crucial role with cancer.
Yeah, and again, it harkens back to the immune modulatory response. So vitamin D not only attenuates and improves the nuance of the immune system, so you have good immunity, but not autoimmunity. But it also increases immunity itself. So all of the things that the immune system is responsible for, looking for infections, making sure there's no autoimmune responses, understanding that, and then of course surveilling for cancer cells and eliminating those. Vitamin D is going to play a role and help out in that respect.
So it's autoimmune conditions, cancer, thyroid disorders. So many people have problems with thyroid hormones. So a lot of these things, vitamin D is so important, and having enough vitamin D. I want to ask about the virus and viruses. So you publish a very interesting, I guess, you mentioned an interesting pilot study that happened in Spain, talking about the role of high dose vitamin D and correlating that with the virus, which happened a few years ago. Can you elaborate more about that?
Yes, this was in Spain. It was a pseudo randomized study, not completely randomized. And what they did was they took the active form of vitamin D. So let's back up a little bit and talk about what that means. So when your skin makes vitamin D from this cholesterol derivative, it's still not yet ready. There's still a couple of processing points that have to occur. The first processing point is in the liver, where a hydroxyl or an OH group is put on one of the carbons on the vitamin D molecule. And then the final step that brings it to activation, so it actually has the active form, is another hydroxyl group that is put on in the kidney. This is the reason why people with kidney disease often need to take active forms of vitamin D, because they typically have less. So once this, what we call dihydroxy vitamin D, or 125 dihydroxy vitamin D, which is the active form, once that is circulating around, it takes just very small amounts of this molecule to do what it needs to do. And this is highly regulated. So there are enzymes which regulate how much of this stuff is made. So in many of the studies at the time, there were supplementing people with the inactive form that needed to be processed into the active form in patients with acute COVID. And some of the criticisms of those studies, the reason, in other words, why it didn't show that it worked, was that they weren't giving the active form quickly enough. It was taking time for the body to make this. What they did differently in the Spanish study is they gave the active form, and the active form is known as calcifediol. And that was the active form. And in that study, there actually was a benefit, as I recall, in terms of mortality from giving that medication. So the problem is you can't get this active form over the counter. It's very highly regulated for good reason. If you were to take too much of this substance, it could actually cause some pretty serious side effects. So it has to be dosed very, very regularly. As it stands here, at least in the United States, it is available by prescription. Usually it's nephrologists that are using it under very specific situations, because of the fact that their kidney patients have metabolism issues with calcium, phosphate, and vitamin D. But to your point, that study did show that there was an improvement, and there were supposed to be follow-up studies on that intervention.
So basically, that study showed less hospitalization, patients needing hospitalization and intensive care with COVID patients. It was 50% needing intensive care. It dropped down to, I believe it was 5% from having 25 hydroxy vitamin D, which is the active form of vitamin D. And that just goes to show how important vitamin D is for the immune system and for viruses.
Yeah. Since that time, what we've looked at as well in terms of vitamin D is looking at the source of vitamin D, of course, which is the sunlight. We can also take oral medications as well. And there's actually been some other studies, some of which have shown that even taking regular doses of vitamin D over a period of time is beneficial at making sure that your body has enough vitamin D. But I think that there's even bigger benefit to getting out in the sunlight to get not only the vitamin D, but some of the infrared light that comes from the sun as well. There's been some recent studies that have shown, especially out of Glenn Jeffrey's lab at UCL in London, looking at mitochondria. And I think that's really the key issue in many of these viruses and diseases that we'll talk about later.
Absolutely. I wanted to ask about the supplementation because there's so many supplements about vitamin D. And then you have to choose the right one. Before I ask that question, I wanted to ask about the vaccine associated with the virus a few years ago. If people had enough vitamin D, let's just say high enough levels, do you think the level of hospitalization would have been less? Vitamin D and other things that you're boosting your immune system.
I don't think there would have been as many hospitalizations. And that's one of the things that on our MedCram channel we talked about many times. Even in March, April of 2020, the first thing we started talking about was sleep and how effective sleep is at improving the immune response. One of the studies that we cited at that time was a study that showed that people getting the regular flu vaccine, if they had 7 hours of sleep, at least 7 hours of sleep before that vaccination, the antibody response to that vaccine was over double than compared to those who had not gotten that. So sleep is a very important modulator of immunity. So sleep, we can talk about other interventional aspects, nutrition, hydrotherapy, sunlight, all of these things. Certainly, people's systems would have been much more healthy, and therefore the effect of the virus on a population as a whole would have been much less. Look, this is the issue, is that our hospital system, at least in the United States, and I can imagine it's the same everywhere else, is structured and is sized at just the right size to make sure that the efficiencies are as perfect as they can get. They don't want to be too big because that's going to be inefficient for the hospital. And they don't want to be too small because they're always going to be running over. And so our hospital systems are designed exactly to take in the amount of sick people that they get every year. A pandemic is going to blow that up. And so you're going to have overrunning of the hospitals. When that happens, you're not able to treat anybody very effectively. And so many times public health officials understand that, and that's why they're concerned about people who might become sick in an excess, especially at different times of the year, and that can overwhelm the hospital system, the healthcare system, the supply chain system, medications, all of these things. And we can talk more about that.
Absolutely. That's why it's important to advocate for your own health and strengthen your own immune system so that if you have different viruses, I mean, we had the virus a few years ago, but we have viruses all the time. The flu, I mean, they use a flu shot. If we can just strengthen our immune system, do we need a flu shot?
Well, that's an interesting point. So not everybody's immune system can be strengthened. And I guess I see that as a physician. Much of my population are people with chronic diseases, some of which they've induced on themselves, some of which, unfortunately, they've inherited because of bad genes. But nevertheless, there are people who don't have a good immune system, and they won't develop antibodies, even if they're given a vaccine. And so these are the people that, we as society try to protect as much as we possibly can to prevent them from getting to the hospital. So I like to use the Swiss cheese model. So the Swiss cheese model is a way, if you can imagine a bunch of slices of Swiss cheese, each with holes at different parts. If you line up those slices of Swiss cheese, it's harder for particles to get through all of them than it is for just one of them. And let's face it, there really is no intervention that's 100%. The example I like to give is the operating room. So one of the major outputs of the operating room, of course, during the operation is to prevent infections. And there are many things that we institute in the operating room to prevent infections. For instance, the surgeons wear sterile gloves. We have the humidity and the temperature in the operating room set to just the right level. The tools that the surgeon uses are all sterilized, and so forth. And so all of these things help to reduce it. If we wouldn't say in the operating room, well, since we've sterilized the equipment, we don't need to wash our hands, right? Or we wouldn't say, because we've used a chloroprep or a betadine on the skin, we don't need to set the humidity and the temperature anymore. So all of these things are working together. And when we do that, the effects are all multiplicative, which means that we can really have an opportunity to reduce things down to a very low level.
Yeah, so when we focus on different things, vitamin D, other things to strengthen our immune system, what we eat as well, our environment, it all helps protect us against these diseases and viruses. I want to talk about you, Dr. Seheult. So you are a quadruple board certified doctor. First of all, how did you have time to do 4 different specialties? That's incredible.
To be quite honest, it sounds impressive, but it's something that you have to do. To be a critical care intensivist, you have to do 3 years of internal medicine, so you have no choice. And then you need to do pulmonary and critical care. They're usually grouped together, so you get both of those certifications. So to do critical care in a pulmonary sense in the United States, you're going to be automatically triple board certified. I went ahead and did a training on sleep medicine. So I also got board certified in sleep.
So my question is, how do you get so interested in the, I guess, natural therapies to strengthen our innate immune system and our bodies? Because a lot of doctors don't focus on that. They'll focus on what they've been taught, but you really make an effort to educate everyone about how we can advocate for our own health. So how'd you get interested in that?
That's a great question. So I would say that I was just like any other physician until the pandemic hit. And when people started coming into the hospital sick, dying, and we had nothing really for them in terms of treatments. We had a few treatments that were out, but they didn't work that well. I think the biggest one that worked out of all of them was actually steroids that we were using. But even then, there was really nothing that was helping. I could see that by the time they got to see me in the intensive care unit, much of the golden opportunity had been passed, and the cascade of inflammatory conditions had gone unchecked, and it was really too late at that point. And so I could see that early treatment was very important. And for SARS-CoV-2, the average time of that treatment or that period of time was about a week. So that's plenty of time to intervene and do something. So why did I start to become interested in this? I started to look for things that might boost the immune system, things that might enhance it. And I went to Loma University, a School of Medicine. And growing up in that area, there was this almost like institutional knowledge or this history of what we as an institution, Loma Linda, and also the church that backs up Loma Linda, the Seventh-day Adventist Church, did over 100 years ago in the 1918-1919 pandemic. So that sent me back to the history books to see what exactly it was that they were doing. And lo and behold, there was an article that I found in one of these journals from 1919. It was an article written by Reuben Wells Rubel, I should say. And Dr. Rubel basically compared what was going on in their hospitals at the time to what was going on in the Army hospitals. This was 1918, 1919. The aspirin had just come out. Bayer aspirin had just come out in 1899. And it was very effective at reducing fever. It was very effective at reducing muscle aches and things of that nature. And the physicians at the time felt that much of the death that was going on with the 1918 pandemic was related to the symptoms of the influenza virus. They didn't even know it was a virus at that time. So they were giving high doses of aspirin, and the fatality rate in the Army camps in the northeastern portion of the United States was about 6%. So what Dr. Rubel thought, and this was something that they had been doing in their church and and around the time this is also the time, by the way, of John Harvey Kellogg, the Battle Creek Sanitarium. They were looking at natural remedies to enhance the immune system. So they were looking at things like hydrotherapy, not reducing a fever, but actually artificially increasing a fever. They were not using aspirin. They were getting patients outside. They actually had these outside camps where people were in the sunlight. And when he compared what he was doing to what was going on in the Army camps, his case fatality rate was 1/6 of what was going on. So I started to look into these things and wondering if there was a scientific basis for this, because this would be perfect to do in a situation where we had COVID, where you had 7 days on average before things started to really get worse. And lo and behold, the science presented itself. We have great data that shows things like interferon, which is our body's defense, not just against SARS-CoV-2, but all viruses, is enhanced when you have a fever. The fever is actually something that is beneficial and should really not be treated. And one of the first things that I started to do in my ICU was tell the nurses not to treat a fever unless it got over 103. That fever was a sign that the immune system was doing something that it needed to do. In fact, we actually even started to do hydrotherapy in our intensive care unit to try to bring up the temperature. Our patients loved it. They actually asked for it once we started to do it. It felt warm, their temperatures came up, and they felt much more comfortable with that. It wasn't until late that I started actually getting my patients with COVID outside, because I started to understand that I think vitamin D, while it is obviously very important, I began to have this understanding that many of the patients that were coming in and doing well because they had high vitamin D levels compared to those that were coming in and not doing well because they had low vitamin D levels, it might not have been just the vitamin D that was doing the heavy lifting, but the very thing that was causing the vitamin D levels to be high, which was sunlight. And we started to see some very interesting and miraculous almost results in getting patients outside.
As Dr. Seheult mentions, getting outside and natural sunlight exposure is a great way to boost your immune system and your overall health. And natural sunlight has so many benefits, and one includes red light therapy. Now, what red light therapy does is that it penetrates several millimeters into the tissue. It enhances energy production, it reduces oxidative stress and inflammation, and also improves blood flow. Now, what does that mean for you? That means that you can experience less inflammation, more recovery, and better sleep, and even better skin health. Now, you can do this quite naturally by getting out in the sun, specifically between the hours of 10 a.m. and 2 p.m. But some people don't have access to natural sunlight, maybe because of their work schedules or maybe where you live. And that's why investing in a red light therapy device might be beneficial. And that's why I have BondCharge as a sponsor of today's video. BondCharge produces high quality red light therapy devices with bioactive frequencies of red and near infrared light at 660 nanometers to 850 nanometers. Now, BondCharge has so many red light therapy devices to suit your budget. And I love this mini red light therapy device from BondCharge because it's portable and it's compact. Now, red light therapy is so important, but we also need to consider blue light. Blue light comes from the sun and it signals to the brain that it's daylight and that we need to have energy. But we also get a lot of blue light in the evening when we don't really want it, especially from digital devices like TVs and our smartphone. So a very simple solution can be to use what's called blue blocking glasses, which block 100% of blue and green light. I like these ones from BondCharge. These are the Morris blue blocking glasses. I just pop these on a few hours before sleep, and I find that I have a better night's sleep. So if you'd like to try BondCharge's red light therapy devices or their blue blocking glasses, just head to bondcharge.com/Primal Podcast and use code Primal15 to get 15% off. I want to quickly talk about doses, because I think people are going to want to know, okay, exactly how much do I need? Because I mentioned earlier that it's what doctors say that it's way lower than the actual recommendation of what we need. I looked online and for adults, it says 600 IU. Now, what you say is very different, and high dose vitamin D to actually treat disease is very, very different. So can we talk about that?
Yeah. So first of all, I'll say that for everybody, it's going to be a little bit different. It varies with age. It varies with percent body fat. Vitamin D is a fat-soluble vitamin. And so the more fat that you have, the more vitamin D you're going to need to take as a supplement to fill up that reservoir. We actually did a video on our MedCram channel looking at vitamin D. And at the very end, we went through some dosing schemes. I myself, and I'll just bring up myself, for instance, I wanted to get up to about 50 to 60 nanograms per milliliter. And I need to take about 4,000 to 5,000 units daily for me to get up to that level. I probably should be spending more time outside. But here's the key point, and this is the point I want to keep coming back to. If you're going to supplement with doses more than 1,000 to 2,000 international units or IUs, you really need to get your level checked because for some people, that might be the perfect dose to get it up to 50. For some people, it might not be enough. For some people, it might be too much. So cycling back and making sure that if you're on a stable dose, going and getting your level checked so you know where you are, and then you can figure out, if you need to increase it or decrease. It's kind of like putting your foot on the accelerator and then not looking at the speedometer. You don't know what kind of a car, if you're going uphill, downhill, you need to look at your speedometer, and getting that level checked is like looking at the speedometer.
Absolutely. And I think it's so important for people to get it checked, make sure that you know what your vitamin D levels are, and then supplement accordingly. But it's important to note that, it is safe up to about 4,000 IU, perfectly safe. I want to talk about high doses of vitamin D. Is there a dose that is toxic to the body?
It depends on how long you give it for. So there was a study actually that we published on our channel where there was an actual case of vitamin D toxicosis. And that person was taking, I think, 50,000 units daily. It was a very, very high dose. And the patient started to develop symptoms of hypercalcemia and all of the other aspects of vitamin D, nausea, vomiting, altered level of consciousness, things of that nature. And it took quite a long time for that vitamin D to come out because it's fat soluble. It's very difficult. You don't just pee it out like your vitamin B and your vitamin C. So it is possible. It's rare, but it is possible. So, but realize that one of the actual interventions that they did during COVID, there was a study where they actually gave 50,000 international units times one. So that's not going to cause toxicity, just giving one dose of 50,000 units. It's the repeated dosing of that level that can cause issues.
Okay. Well, at least we know that, most people are not going to supplement with 50,000 IU, but I think people, even 4,000, 5,000 IU, they might be thinking, oh my God, that's really, really high. Is that safe? That is safe, but make sure that you get your levels checked first. I want to talk about the mechanism by which vitamin D gets into your body, because people think it is the sun, and it is the sun, but there's a difference between UVA rays and UVB rays, and what we need and how much sun we need, and how that actually happens in the body. You alluded to it earlier, but if we can explain that, people can understand, like, oh, that's how I get vitamin D, not by being inside and having the sun shining through the window. I'm not going to get vitamin D that way. There's another way that we have to get it.
Yes. So it's understanding a little bit about physics and wavelengths, and understanding that when you look outside and you see light that's visible, this type of light that we're talking about is invisible. It's beyond the purple. It's ultraviolet, in fact. And there's three types of ultraviolet rays. There's ultraviolet A, B, and C. C is extremely short wave and probably doesn't even make it through the atmosphere. B is the next shortest wave, and it has trouble getting through, especially through windows. So if you're behind a window, you're probably not getting much vitamin D because UVB is so low. The time that you need to get this naturally is between the hours generally of 10 o'clock and 2 o'clock in the afternoon. This is when the sun is the highest, and therefore it's easier for those rays to pass through the atmosphere because it's attacking it directly on. This as opposed to infrared light, which doesn't really matter, but it's so long wave and it's able to penetrate so easily that even when the sun is coming up in the morning or setting in the afternoon, you're going to get plenty of infrared light. But that's not the light that's going to help you. It's ultraviolet light, specifically ultraviolet B, as you mentioned. And that's for you to do that, you have to go outside. Now, interesting aspect of this is that the way that the atmosphere is set up, you're actually getting more ultraviolet B light from the sky that is reflecting the sun, because the sun, as it gives off its light, it's scattered. We call this Rayleigh scattering. And that scattering is particularly high in the blue spectrum. That's why the sky is blue, actually. And because of that, you are actually getting a lot of ultraviolet B radiation, which is vitamin D producing, not just from the sun, but also from the sky when the sun is up as well. And so because of that, you don't necessarily need to be in direct sunlight to get vitamin D. You can actually be outside, and the sky, which is reflecting the sun, is going to give you much of that UVB.
So I'm thinking about people that live in the UK or Canada or North America, and in winter, maybe there's not much sunshine. Can you get enough vitamin D if it's cloudy?
So classically, if it's cloudy, yes. So ultraviolet can penetrate through clouds. Infrared has some difficulty because water vapor absorbs that, but it is possible. And there's sort of some mixed feelings on that. A lot of, before we understood that ultraviolet B can come from the sky around the sun, many of us believed that when the sun is too low in the sky, people are not going to make enough vitamin D. that may be in question. There may be enough vitamin D being made if the sun is reflecting that Rayleigh scattering. Obviously, even in the wintertime when the sun is up, the sky is still blue, which means that this scattering is still happening and that there may be enough ultraviolet. This is a new idea that's sort of hatched open here in the last 10, 20 years. So I don't think the studies have been done, but classically, you're right. In the wintertime, probably Tennessee, if those living in North America, the latitude of Tennessee in the wintertime is probably as far north that you can go and still get vitamin D. Anything north of Tennessee or that latitude, you're not going to get enough vitamin D.
And that's where supplementation can come in, which I want to talk about. What about sunscreen? Many people wear sunscreen. I think people that are highlighted to the fact that sunscreen might not be the best, they wear less sunscreen because they understand the benefits. So sunscreen, does that affect the absorption or the amount of vitamin D that we can get?
To the degree that it blocks ultraviolet light, yes, it will prevent us from making vitamin D in our skin. The whole purpose of sunblock is to reduce, or sunscreen is to reduce the amount of ultraviolet light that could cause damage. And it's this ultraviolet light classically that is going to cause mutations in the DNA, which leads to the cancer. So yeah, sunscreen is designed to block out all of that in that ultraviolet spectrum.
Okay. Do you think that, because there's some people that say, well, sunscreen is just totally toxic. You should not use sunscreen. The sun is natural. We need it for our health. And that cancer comes from dietary things like processed foods, seed oils. What do you think about that?
I think it's an interesting idea. I'll say this, that we know that if we take skin cells, for instance, and in the lab expose it to ultraviolet light only, that's very conducive to creating skin cancer. However, the reductionist there is missing the other picture, which is that we never really go outside and get ultraviolet light only from the sun. It's usually mixed with infrared radiation. In fact, the majority of the photons coming from the sun are in the infrared spectrum. And so what we see instead is we see infrared light mixed with ultraviolet hitting the skin. And if you look at epidemiological studies, people who are exposed more to that type of light getting outside actually have reduced cancer. They actually have reduced all-cause mortality from cardiovascular disease and from non-cardiovascular disease as well. And that's been reproduced many, many times. In fact, there was a article that was just published in the Journal of Investigative Dermatology by Dr. Weller from the UK and Richard Weller, stating is the same and saying that, we as dermatologists have been saying this for years, that you need to get out of the sun, avoid the sun, put on sunblock. And the data is just not backing that up in terms of mortality and in terms of cancer. Now, all-cause cancer, all-cause mortality went down. All-cause mortality from cancer went down. There might have been a little bit more in terms of cancer from skin type of skin cancer, so melanoma and basal cell. But overall, it went down. So I think the jury is still out on that. It's possible that seed oils could be causing the skin cancer, could be diet, it could be that. But it also could be related to the fact that many of the research studies that we've looked at is only ultraviolet. And we're looking at that. And we're thinking that because ultraviolet by itself does something, that we're just extrapolating that any ultraviolet in any environment is going to do the same thing. That may not be a good scientific conclusion.
I think so, because when people make these conclusions that don't go in the sun because that's going to cause cancer, well, we've been in the sun for millions of years. So how can that be? It's good that you made that clarification. I want to ask you about supplementation regarding vitamin D, because D3 is what you need, not D2. Why is that?
Well, it's just the structure. It's the way that the structure moves it. Although I think that D2 is probably there is a thought process that D3 is probably better for the human body than D2 because there's a few more steps that have to happen. I don't know if that's actually panned out in terms of clinical trials. I don't know data on that specifically, whether D2 and D3 have different clinical outcomes. I know that there's a difference biochemically. I don't know if that's translated into clinically.
So do you need to have K2 with a D3 or D2 for better absorption? Because this is what I hear. So I'm asking you this question.
Yeah, so it has to do with calcium deposition and if calcium is left in the arteries. And I think there is some data that vitamin K2, which should not be confused for the other vitamin K that we do for coagulation, but it's something that's a little bit different. There is some data that seems to suggest that K2 might be beneficial as well when taken with vitamin D as well.
So if somebody just takes a vitamin D, so first of all, if they get their vitamin D tested, they know that they are deficient in vitamin D or that they need higher levels of vitamin D, then they use a D supplement, so D3 or even D2, maybe with some K2, totally fine.
Yeah.
Okay. And then supplement to the point that you get above 50. Is that correct?
That's my cutoff. That's what I think is what I do. And the reason why I'm informed on that number is just I came to that conclusion looking at the COVID data, because once it started dropping below 50, we saw an increase in COVID-19 infections. So if I'm wanting D3 or vitamin D for immunity, then that was my battle tested plan. If it starts going up below 50, then that's where I want to be.
Okay, I want to ask you let's talk about COVID, because things that can boost the immune system. So I want to talk about other things that can boost the immune system. But I want to understand, what are your thoughts about the vaccine?
Yeah. So again, it's another one of those slices of cheese that we had at the beginning. There are many people that have optimal health and wouldn't need to worry about getting infected because they would come down with a cold and then they would get better. There are some people, though, that came down with a cold, got better, and they had long COVID. There's some people that obviously did not do well and ended up in the hospital. I took care of those patients, so I saw them. So because of this wide mix, it's really hard to say that one particular thing for everybody would have worked. I think what we needed to do, and again, because of what we talked about before in terms of the healthcare system, is that if there was a huge influx of people needing hospitalization all at once, that's really difficult to deal with. If you think about it in a particular area, now this didn't happen all at the same time in the United States, but let's just pick a particular area and say in a particular area, if there is a wave of infections going on, that's going to be affecting a lot of people. And it's going to be affecting people who are already sicker than those that are healthy. Those are the ones that are going to be needing healthcare. And unfortunately, right at that moment where they're needing healthcare, unfortunately, the people who are supposed to be providing the healthcare are going to be sick as well, and they're not going to be able to do that. So it's kind of a double whammy. If you're using medications to try to deal with this, those medications are going to be on shortage. There's not going to be enough of them. And so you can see very quickly how things start to unfold and spiral out of control, such that even if, let's say, you're healthy and you're not going to get a serious illness from COVID-19. Let's say you get into a car accident or you need hospitalization for some other reason. Well, now you're impacted, even though you were perfectly healthy, even though you're ready to take on COVID-19. Now, if you need medical services, you can't get them because they're completely impacted by everybody else. So it's not like these are independent islands of people out there in the community that they're fine, therefore they don't have to worry. Unfortunately, all you need is just a small bump that can overwhelm a healthcare system that's perfectly designed to deal with non-pandemic situations, and things can quickly get out of control. So again, sliced cheese. So what we're looking at is health immunity. We're talking about nutrition, exercise, hydrotherapy like water. We're talking about sunlight. We're talking about avoiding things that can make things worse, like alcohol and tobacco. We're talking about fresh air, making sure you're getting enough sleep, and trusting in a higher power. All of these things work together to optimize your health system. But are there things that you can do to boost immunity, to make sure that your immune system has seen this? And the vaccine offered that situation. So vaccines basically just tell your immune system ahead of time what something is without having the effect of the ravages of a replicating virus in your system. And I can tell you that I've looked at this several times. If you were to graph out excess mortality, so I've actually done this at our website, and this convinced me, at least acutely, that vaccination was the right situation to do. If you look at and graph out the incidence of SARS-CoV-2 infections, okay, and you put that linearly across the top of your page. And then you graph out excess deaths. So this has nothing to do with what they put on a death certificate. This has nothing to do with what people think someone died of. If you called everybody who died of anything COVID, or if you called nobody of what they died not COVID, it doesn't matter. Just if there is a death certificate and you map that out, you would see that as SARS-CoV-2 waves went up and down, independently of that, so did excess deaths go up and down. Now, if you put on top of that the vaccination drives that we had, just to give you some numbers, at the height of the pandemic, we were getting about 300,000 infections a day. Okay, that's a lot of infections a day. But that pales in comparison to how many vaccinations we were doing a day. We were doing about 3 million. So 10 times that amount, 3 million vaccinations. I think it was April 11th, 2021 was the single biggest day of vaccinations in the United States. And if you look on the graph at that time, what the excess deaths were at that time, it was at the lowest point in the entire pandemic. And so at least acutely, if COVID-19 vaccines were causing acute illnesses and deaths, and we've gone over the VAERS graph on our MedCram channel, then I would have expected to see, just like if COVID was causing excess deaths, and I see that the pattern of excess deaths matches that of COVID-19 infections, then I would also expect to see something very similar to the pattern of vaccinations that we did in this country, and there's no such pattern of excess deaths. So how do I actually correspond that to my own personal experience? I worked in an ICU. Many times my preceptors would say, look, as critical care physicians, we're at the bottom of the drain. Nobody dies without seeing you. If someone's sick in the hospital, as they're dying, they're eventually going to make it to your intensive care unit. And that's exactly what I did. I worked in a one hospital town. Everybody that got sick came to that hospital. People that got worse, they were in my ICU. So I saw all of them. And I can tell you that after we started introducing vaccination in early 2021, 95 to 99% of the patients that I saw that were in my intensive care unit were patients that were not vaccinated. And that's just the truth. That's just the truth of what I saw. And of course, there are people that are vaccinated that still ended up dying from COVID-19. But generally, these were people with very poor immune systems. This is where that slice of cheese did not work. I just want to say that I was against mandatory vaccinations. I don't think that was the right thing to do, forcing people to get an intervention. Number one, it wasn't something that I believe would endear trust. That's the first thing. Second of all, I don't believe that we should be mandating any medical intervention. Everyone's an individual. People's needs are different. That's why we have physicians, people in the healthcare industry to look into their history, look at their medical history, and decide if something is good for them. There was plenty of patients in my clinic that I did not recommend them getting the vaccine because of allergies or things of that nature. So I think it's a personal decision, but looking back at the actual raw data and making that assessment, I'm still of the same opinion.
Okay, so it had kind of a net positive benefit only because a wave of a pandemic, you need to control the infection. But I almost think that if we could strengthen our own immune system, and it's separate for people that have a weak immune system, that's a separate category. But if people were generally healthy, perhaps that could also help along with the vaccine.
100% agree. Yeah.
But I agree when you say that perhaps it shouldn't have been mandated, because that is a question that people have, like, why do you have to mandate that? Because people couldn't even work unless they get the vaccine. So I just wanted to ask that question. I wanted to ask about myocarditis, heart inflammation from the vaccine. Why did that happen?
Yeah, so myocarditis is a very common condition that happens during infection. So we see it in the flu, in influenza, we see it with COVID-19 itself. And we also see it with the COVID-19 vaccine as well. There was a study that was published in Circulation, American Heart Association, where they looked at, I believe, 42 million people. So this is the largest study by far of any study that looked at the incidence of this. And just sort of back up a little bit here. The size of a study is very important in that it allows you the resolution to pick up these rare conditions and to be able to tell if one thing is higher than another. It's kind of like a satellite. If you have a satellite photo that's poor resolution, you really can't tell at all what's going on. So when you have a study that has 48 million, you're able to really get down to the nitty gritty and say, yes, this is higher than this and this is higher than that. And what it showed was that the highest out of all the populations of people, whether you're looking at people who had COVID-19, people who didn't have COVID-19, people who were vaccinated with the Pfizer vaccine, people that were vaccinated with the Moderna vaccine, first time, second time. I mean, it got very, very specific. You can do that when you have, tens of millions of people in your study. What it showed was the highest incidence of myocarditis was in the Moderna on the second vaccination. All of the others were less. The second highest one was the COVID virus itself. And then all of the other incidents of myocarditis was under that of COVID-19. So this is a risk. I'll be the first one to tell you, there is no intervention on this planet that is without risk. Every intervention, even natural remedies, have risk. You can burn somebody doing hydrotherapy. So it's possible you can have risk. So you always need to look at the risk versus benefits. So let's stand back and look at this. If we're in the middle of a pandemic where everyone around you is coming down with COVID-19, which is where we were about 3 years ago, and you've got this kind of a risk function. First of all, this is extremely rare regardless. You have the almost assured chance of getting myocarditis from COVID-19 because COVID-19 is so prevalent versus getting a lower risk if you take anything other than a young person. By the way, it was young people with their Moderna second shot. So that's a risk calculation that you can make. And I made that risk calculation. I was vaccinated in a heartbeat because, first of all, I'm working in the intensive care unit around COVID patients. So for me, it made a lot of sense. There's a very high likelihood that I was going to come down with a SARS-CoV-2 infection just based on my job. So for me, it made a lot of sense. I didn't want to bring this thing home. Now, let's go 4 or 5 years later. Okay, so what's the incidence of SARS-CoV-2? It's still there. In fact, some might even say it's even higher now than it was back then based on wastewater data, right? But it's not causing the severe illness that we saw. Why? Either through vaccination or prior immunity because people have caught this virus. Our immune systems have seen this before. They have T cell memory, and this is not causing the cytokine storm by any shot that we saw back in 2020, 2021. So now it's a little bit of a different calculus, right? So are you going to get a vaccine which for sure you know you're getting the vaccine, and so now you're introducing this risk of myocarditis versus a getting the virus itself for which your immune system has plenty of immunity to see it. So that's one way of looking at the calculus. Obviously there are people, and let's be sensitive to this as well. There are many people out there that have gotten COVID once, twice, 3, 4 times, and they are suffering from long COVID. And so for them, this is a real problem. And so, mitigating further COVID-19 infections is a real thing for them as well. So there's a lot of different risks here. And this is the reason why we really can't make these broad blanket decisions in terms of vaccination and mandates because everyone's an individual, and because it's so nuanced. I really think that an individual's decision and a physician's decision with them together should come up with that in terms of a idea or a decision.
I want to ask you about spike protein. This is something that I saw on the internet. I was thinking, what is spike protein? So basically, when you got the mRNA vaccines, that attacked the spike protein, which is part of the COVID virus. Now, what is this thing about spike protein now, and should we be worried about spike protein?
So spike protein is just simply the tip of the virus that interacts with the human body. It actually hits the ACE2 receptor, and that brings up a whole nother bunch of issues too, because ACE2 is a modulator of oxidative stress in the cell, and that can cause issues. The problem with the spike protein on the virus is that it wobbled. There was a confirmation before it attached, and there was a confirmation after it attached. And so that's really difficult to make antibodies to, because which one are you making the antibody against? Some may have said retrospectively, maybe correctly so, that maybe attacking a different protein on the virus may have made a better sense because the spike protein may be so toxic. I could see those arguments, and that's reasonable. What they did in this case was they tried to lock in the spike protein in its pre-fusion conformation. And that's what they did. Jason McClellan's work at UT actually did this with proline residues, which basically made a spike protein which didn't move. And so the spike in the virus is actually different than the spike in the vaccine. It's a different spike. The spike in the vaccine cannot cause the conformational change in the ACE2 receptor like the spike in the virus does. And that's important to understand for a number of reasons. Number one, it allows antibodies to be made against a particular protein that's not moving. And so that antibody can then be directed against the spike protein on the virus when it's in the pre-conformation conformation. But it also means that when you have the spike protein from the vaccine in your body, it's interacting with ACE2 in a different way than the virus does. And I think that's important to understand.
So is a spike protein still in our body now if we've had the virus, taken the vaccine? Is it something that we should be worried about?
I think there's some studies that seem to indicate in a minority of people that they can find the spike protein after vaccination. But let's face it, you can also see that in COVID-19 infections that have persisted for months. So I don't believe that's a function of the spike protein. I think that's a function of the immune system of the person and their ability to get rid of spike protein. And this is, again, a reason why that I focus on the importance of building your immune system so that you can get rid of spike proteins.
Okay, let's talk about building the immune system. So we circled around vitamin D, talking about the vaccine, because I wanted to ask about that. But in any case, if another pandemic comes, you mentioned disease X, which I don't know what that is, but it sounds like another pandemic. So these things come and go, viruses, all these things that happen, but we can take control of our own health and at least protect us as much as we can. So we spoke about vitamin D, very, very important. But there's other things that you mentioned that are very important. I want to talk about the hot and cold temperatures. So you mentioned fever is important. If you have a fever, the doctor should not try to lower the fever. That's the immune system fighting the infection. Can you elaborate more about that?
Yes. So we've known for a long time that interferon is the security guard at your bank. Okay, your body is the bank, and your security guard is the interferon, and it has a very wide range. Interferon is a protein that your body makes to kill viruses, to get rid of viruses. And it really doesn't matter which variant it is. So this is nice, is that it can mutate. It doesn't matter. Interferon has it. The issue is that most respectable viruses today, almost all of them have ways of getting around interferon. Just like if you want to rob a bank, you've got to have a plan. How are you going to get past the security guard? How are you going to open the safe? Most viruses that want to get into the human body have to have ways of defeating your body's innate immune system. And so interferon is no exception. And we've known this actually since the pandemic. And we can show you genes actually in SARS-CoV-2 like MAC1, which is really designed to get around interferon. So what do? We've noticed, whereas with SARS, the original SARS virus in 2002, which had high fevers, we were able to figure out who those people were that were infected, and we were able to isolate them. And the SARS virus, the original SARS virus from 2002, was isolated and it never turned into a pandemic. Unfortunately, with SARS-CoV-2, there was a lot of asymptomatic spread. People were having infections without fevers. And this was a defense mechanism that the virus had to get past your immune system. So one of the things that has been shown is that if you are able to increase your body temperature, one study that I reference up to 39 degrees Celsius, another one even up to 38 degrees and a little bit past that, there's a whole set of genes that get turned on. There are interferon genes that get turned on. Interferon itself is secreted at tenfold that level once your temperature goes up to this level. And these have severe consequences for SARS-CoV-2 infections. This is exactly, by the way, what they were doing. The reason why I looked at this is exactly what they were doing in 1918 and 1919. There's articles that I was able to find in Minnesota. This was at the Minnesota Seminary, where an entire building of seminary students came down with the dangerous 1918 flu. And immediately they put to work isolating them. They went and did hydrotherapy intently on these patients, so they were increasing their body temperature. And these were young students in their 20s. That was where most of the mortality was in 1918. Not a single student in that seminary lost their life from the flu. They actually made it into the news reports at the time. So I think it's really important understanding that your innate immune system is there. It's ready to take on any type of virus. What we need to do, especially if we're not optimally well, is to boost that immunity by increasing body temperature. And there's various different ways of doing that. You don't need a sauna, an expensive sauna to do it. This is something that's accessible to anybody. You can get hot towels, put in a microwave. Make sure you have a towel on your body that you put this on top of to heat up the body. These things have been around. They're known as hot fomentations. This has been around for hundreds of years. This is what they used to do to treat patients. And I'm sure all of you in your audience have grandmothers that would tell you, go sit out in the sun, you go to bed, put the covers on, sweat it out. These are the sorts of things that we as a society anthropologically have known has benefited people with viral infections.
Okay, so you don't have to do hydrotherapy. So what is hydrotherapy?
So hydrotherapy is simply using water in the heating up of a person's body to fight infections. The reason why water is so important is that water has a high enthalpy of energy, which means it takes a lot of energy to raise water a specific amount of degrees. And therefore, when you have something of a specific degree, that water is going to transfer that heat very well to the patient, and it's going to be very effective at increasing the body temperature.
So, but just raising the body temperature, free tools, which is using some hot towels, go out in the sun, put some blankets on you, sweat it out, and let that fever happen, because that's the way that your body is helping with your immune system.
For about 20 minutes, and then followed by a cold cycle where you apply cold water, ice cold water for about a minute. This has the tendency of causing vasoconstriction, and there's a bunch of white cells that get demarginated off the side that go into circulation. There's actually quite a lot of science that they've done on this topic.
I imagine that would be quite hard if you're really sick and you have to go really hot and then really cold, but very, very important, especially if you're saying that. That's something that we should do. I want to ask about sleep. People know that sleep is important, that we should sleep. But you mentioned something about 7-day cycles, that the body runs on 7-day cycles, and that affects our circadian rhythms.
It is a circadian rhythm. So there's a circadian rhythm that we're all aware of, which is slightly more than 24 hours. And that has to be reset every day. And that's important. That's why you have light in the morning and light in the evening. But there's also a 7-day cycle. And, it's really interesting that the human body, we've actually shown this, that there are animals, that there are humans that actually have a 7-day cycle. And there's certain things that repeat every 7 days. Every single society on the planet has a culture that is 7 days. And this is something that we didn't coordinate. It's something that we didn't plan. And it's really actually quite interesting if you look at it. There's no astronomical phenomenon that would lead us to a 7-day cycle. For instance, the Earth rotates around its axis in 24 hours. The moon around every 30 days, 28 to 30 days. Obviously the sun and the Earth every 365 days. So there's nothing there about 7 days. But we see this even in the most ancient literature. During the French Revolution, they tried to change it to a 10-day week. It wouldn't work. The human body is just not synced to that. So, if you look around the world at the populations that have the longest lifespan, the best longevity, these are populations that are not on the go all the time and doing 7 days a week. These are people that are taking a break. These are people that are reflecting. One of those populations I'm very familiar with, so I'm a little bit biased in this, is since I grew up in Loma Linda, it has had historically probably one of the highest life expectancies on the planet. This is even before the blue zones came out in 2002 or whenever it came out. It's the reason why it was selected as a blue zone, because of this history of longevity. Well, the 7-day Adventists have a long history of making sure to take that 1 day off per week, not just to go to church, but also to sort of like disconnect, to turn off from the work week, to make sure that you're not checking emails, doing texting, working, and to really, spend time with those things in your life that are really important. And I think that really has a big impact. Every week you have the chance to sort of take your head up out of the water and kind of assess yourself. Which way are you going? Are you going in the right direction? And where, and give you that break that you need. I think that's actually really important.
I think that's important to disconnect And it's not a medical intervention. It is a human natural thing that we should do to actually protect our immune system and strengthen our body is to have that time outside. I want to talk about nature and why being outside is so important and the sun beyond the vitamin D because people are inside. I read a stat that about 95% of our time is spent indoors.
Yeah. I think the numbers, I think it was an EPA study that was done about 10 years ago, and it was 87% indoors and another 6% in vehicles. So added up 93% indoors. I think in Great Britain, it was 92%. So the Brits are a little bit better at getting outside. Maybe it's that green thumb that they have that we don't. But yeah, no, absolutely. So when you are outdoors, number one, you're in the sun. Number two, we already know that there is major health benefits for people that are in green spaces. There was just a study that was released a couple of weeks ago. This was in Louisville, Kentucky. And for many years, people said, oh, it's a confounder. People that live in green spaces tend to have better lifestyles. They tend to exercise more. They have a higher socioeconomic status. Well, they set out to debunk that. And what they did was they planted 9,000 trees. And these are not like seedlings. These are mature trees in a 4 square mile area in Louisville, Kentucky. And before they did that, they measured CRP levels, highly sensitive CRP, and then they measured it again afterwards with a bunch of other studies. But let's just look at the CRP. CRP is a surrogate for cardiovascular disease. So it increases your risk of stroke, heart attack, things of that nature. 13% reduction just by planting trees outside. So this affected those people in such a degree, even though they're inside 93% of the time, that just planting that many trees had a reduction in CRP by 13%. That's the equivalent, by the way, of doing regular exercise. That's the same amount of reduction that we would see. So what's going on here? I mean, if you were to ask me, I would say that it's probably highly indicative of infrared light and the benefits of infrared light, because trees, plants, shrubs, anything that's green is highly reflective of infrared light. And so the small amount of time that we're outside, you're going to be getting that benefit of near infrared light on your body. But there's more than just infrared light that trees provide. Many trees give off what we call phytoncides. These are chemicals that are made naturally in the tree that when we inhale them, they interact with our immune system and boost our innate immune system. There's many examples of this in the scientific literature. Eucalyptus oil. There was a study that was done in Japan looking at Hinoki cypress. That's another type of oil where they took Japanese CEOs living in Tokyo up into the Hinoki cypress forests, and they were able to see real differences chemically in their immune system that was actually able to be reproduced when they had them sleep in a hotel room in Tokyo and infuse the room with this Hinoki cypress oil. It was a little bit better in the Hinoki cypress forest. There was actually reduced cortisol levels, reduced stress. So we're talking about sunlight, we're talking about fresh air, we're talking about forest bathing. There is real data. This is not just, woo-woo stuff. Real data that shows that getting out in that environment is better for your cardiovascular disease, better for your mental health, depression, all of those things.
Yes, absolutely. And beyond what you eat, I think people try to focus on adding things, but actually just living a simple, natural life actually can make you healthy. Last question for you. You mentioned a next pandemic is coming. I don't want to scare anyone, but when is that happening? And can you list the main things anyone watching has to do to protect themselves as much as they can?
Absolutely. So, looking on the forefront here, we see things that are happening in for instance, in Africa. The Marburg virus, that's a pretty deadly virus, 80% mortality. I don't know if that's a good candidate that's going to make it globally because of just the nature of that virus. It's not airborne, it's contact. I think if I were to say the biggest one, it's going to be a flu. H5N1 is something that certainly is pretty concerning. I don't know when it's going to happen. It may be years. Hopefully it is. Hopefully it's after my lifetime. I certainly don't want to see another pandemic. But I can tell you, I want to be prepared for that. And so let me tell you what I have seen in terms of the data. So first of all, I like to use the mnemonic NEWSTART, NEWSTART. I say that because there's actually a program that I've followed at Weimar University on the West Coast of the United States in Sacramento that goes through each of these things in terms of their programs and helping people with lifestyle. So N for NEWSTART starts with nutrition. So nutrition is really important. Everybody knows it's important. In terms of nutrition, I do believe that eating 2 meals a day is probably better than eating 3 meals a day, and really limiting that last meal of the day. That's closest to bedtime. That's really when our rest and repair systems kick in when we go to sleep. And if you're eating too close to that, it's going to impair that ability to do that. So eating too late at night, I think, is a bad idea. That's N. E, exercise. Exercise is really important. But a lot of people, when they hear me say exercise, they think of very strenuous exercise. I'm not talking about strenuous exercise. Actually, moderate exercise is better than strenuous exercise if you're trying to make yourself pandemic proof. Moderate exercise improves your immune system. Excessive exercise actually is detrimental to your immune system. And when I say excessive, I mean strenuous stuff to the point where, for instance, Olympic athletes have to really watch their abilities in their immune system because they are impaired when they're doing that kind of strenuous exercise. All right, NEW. So W stands for water, and that's the hydrotherapy that I was talking about. So this idea of hormesis, exposing yourself to extremes, brings out in your body some hormesis reactive proteins like heat shock proteins, which can be beneficial in other areas, especially when you get high fevers from a pandemic or virus. All right, that's NEW. So START, S-T-A-R-T. First S stands for sunlight. So we've talked a little bit about sunlight. I am really, really a big believer in getting outside into the sun. I think it's really beneficial. If those people have very sensitive skin and they're concerned about getting skin cancer, look, you can cover up. You can wear full clothing, broad rim hat. The sunlight that's coming through, the near infrared light, is really important. It's going to penetrate through all of that, go into your body. It's going to interact with your mitochondria. And that's really important because the mitochondria is felt to be actually the basis of aging. So the mitochondrial basis of aging is really important to understand. Oxidative stress. We didn't talk about it too much, but I'll stress that here for sunlight. T, temperance. So eliminating all of those bad things that we know are bad for us, but they feel good, but they're not good for us. So tobacco, alcohol, drugs, all of these things have been shown very, very well to impact our body and our ability to deal with a pandemic. A, air, getting outside, fresh air, as we already talked about. The R stands for rest. And that's not only a daily rest, but also a weekly rest. I think that's really beneficial. And, sort of the last area of wellness that really hasn't been explored scientifically as much as it should because of its nature. That last T for New Start is trust. Trust in God, trust in a higher power. There's a lot of burdens that we carry when we are having to do everything ourselves, and that causes anxiety. When you have trust and you have a relationship, community, this is really important. And the science has shown that it's very beneficial when you know that there's someone else that you can depend on, that it's not just you. So I think New Start really is your basic protection against future pandemics. And, the nice thing is that it also works for a lot of other things as well.
And it's free. Everything that you mentioned is free. I just wanted the last comment that I'll say is that what I've noticed on social media, and I think people are hanging around social media, there's so much negativity. And when you said trust, that is taking away that trust. That is taking away that social connection and that positivity and the energy that we need to actually thrive as humans. And that protects our immune system and that strengthens us as a person, basically.
That's very insightful.
Well, Dr. Seheult, thank you so much. It's so interesting that you are, as I mentioned, quadruple certified, board certified doctor, but you make so much simple sense and you drill it down to something that people can understand to have overall health. And I'm sure that there's going to be another pandemic happening, viruses, flus, all these different things. But I think if we can do the things that you say, we can protect ourselves. If people want to find you, you have a fantastic YouTube channel. Where can they find you?
Great. Yeah. So we're on YouTube, MedCram videos, or just MedCram is fine. For those interested in continuing medical education, for those who are healthcare providers and want to get CE units, we also have courses on medcram.com, and it's available there as well.
Wonderful. Well, thank you so much for your time. And I'm sure people are going to get so much value from this. So thank you so much.
Thank you.
Thank you for joining me on this episode with Dr. Roger Seheult. If you'd like to learn more information about how to improve your vitamin D and the supplements that you need to take, there is resources available in the Primal Labs. Simply click on the link of this video. You'll see learn more about vitamin D. Click that and open it up, and you'll see all the information about vitamin D and the supplements that you might need to take. Now, if you're learning from and enjoying these free episodes, please hit the subscribe button. That is an excellent zero-cost way to support this free health podcast. You can also find me on other social media accounts. I'm on Instagram and on X, formerly known as Twitter, under the name of the Primal Podcast. And if you love this episode, you'll also enjoy another episode I did with Dr. Mark Berhanna. Dr. Berhanna is a functional dentist and will discuss how you can improve your oral microbiome and the things that we're doing every single day, including the toothpaste that we use, the floss that we use, and products that are destroying our oral microbiome. And he'll give you the perfect oral routine to fix your mouth and your overall health. Finally, thank you for your interest in root cause healing, and I'll see you next week.